We're here today with Brooke. She's an RN at Duncan Medical in West Portsmouth, Ohio, and she's going to talk today about some of the things that you need to do to take care of your diabetes. So, thank you for talking with us today, Brooke.
Hi, I'm glad to
Hi.
be here.
One of the things that a lot of the patients ask is how should they monitor their sugar at home?
It's really important to check your blood sugar before meals and at bedtime. So definitely checking them before meals and at bedtime, um, and keeping a close eye. And it's really important to keep a log of them too at home.
Yeah, the log helps us when you come into the clinic because we can kind of see the different trends. And a lot of people want to check it just once a day in the morning, but if you check it at different times, then you can kind of see how your food affects it through the day without using a bunch of strips if you can't afford them. So that's
Right.
one thing that we recommend. And when people come in for an appointment and they have diabetes, what should they expect?
Usually, whenever patients with diabetes come in for their appointments, the provider will ask them, how their blood sugar has been running at home. So, like we were saying, the log, make sure you're logging your blood sugar at home. And you know how I mentioned earlier, you need to check your blood sugar before meals and at bedtime. So, I know it's a lot to log throughout the day. Ideally, if you could at least just do two, blood sugars throughout the day, especially the morning one and the evening one. I know it's hard to log all of them, but try to keep a close eye on them and as best as you can. But so going over your logs whenever you're in the office, and your provider will ask you about symptoms that you're having, like if you're having increased thirst, increased urination, increased appetite, any numbness or tingling in your feet, any weakness or fatigue, things like that. That's what your provider will ask you during your appointments. But they'll also check your A1C whenever you're in the office for your appointment, and your hemoglobin A1C. That will tell us a good picture of how your blood sugar has been running over the course of 3 months. And over the course of 3 months, that's the life of a red blood cell. So that's why your provider likes to check your A1C, so we can get a good idea of how your blood sugar has been running throughout that 3 month period. And so, yeah, we'll just ask you questions and see how you're feeling, and making sure you're taking your medication as directed. And yeah, pretty much that's what they're asking you.
And I know one good thing about our clinic is we check the A1C at point of care. So if some offices don't and you have to go to the lab and get a draw, but we can just do a little finger stick. It's very little blood and it only takes about 3 minutes to get a result. And then that lets us know if we need to adjust medicine right then without any waiting time. So that's good.
Yes, it's awesome.
Then people will say exercise helps the blood sugar. Um, can you speak a little bit on that? Like, how would exercise help if someone was having high sugar?
Yeah. So exercise, obviously, whenever you're exercising, you're going to lose weight. And if, a lot of type 2 diabetics have the issue of obesity, but not always. There are type 2 diabetic patients that aren't overweight. However, whenever you're working out, your muscles, I'm sure you've heard the phrase, food is fuel. So your muscles use glucose or sugar as energy. So, so basically, whenever you're working out, your muscles are taking up extra blood sugar, through or sugar through your bloodstream, and it's going to in turn lower your blood sugar. So actually, exercise is the best natural way to lower your blood sugar, because essentially your muscles are using up that excess blood sugar that's in your bloodstream, um, to decrease your levels.
And one thing that exercise doesn't have to be like a running a marathon, even just taking a short walk at a slow pace, any kind of extra movement will help you use sugar better.
It's absolutely imperative that a patient with diabetes go have yearly eye exams to assess and or prevent diabetic retinopathy that can lead to blindness. So that's the eyes. Diabetic foot exams, it's important that you get those yearly to assess for neuropathy. Basically, your provider will get a monofilament, which is a little plastic flexible thing, and they'll press on the bottom of the sole of your foot, and if determining to see if you have any numbness, and that could determine if you have neuropathy. So I actually took care of a patient in the hospital one time. He had really bad diabetes, and he was telling me a story whenever he was in there that several years ago, prior to him being in the hospital that time, he had stepped on a Gatorade bottle cap. And, those are really kind of big. And he had no idea that he had stepped on that Gatorade bottle cap because his diabetic neuropathy was so bad. And how he discovered it was he was in the shower and he saw blood running in the bottom of the shower, and he picked up his foot and saw that huge Gatorade bottle cap on the bottom of his foot. So that's how extreme, you could have this numbness. So, obviously you need to check your feet at home daily and check your feet. You could, like that man, he didn't know that he had stepped on that bottle cap. And then labs, you need to do an A1C. The office that I work at, we do A1Cs every 3 months. And then you need to do, usually we do a GFR, a creatinine, a BUN, and a microalbumin. And that microalbumin, whenever you go get your labs done, they'll give you a cup and have you urinate in it to assess for protein in your urine. And if you have protein in your urine, it could indicate kidney damage. So we definitely want to monitor for that. And then also, it's important that you get a lipid panel done yearly to assess, because usually type 2 diabetes is associated with high LDL levels, which is your bad cholesterol. So, and ultimately, that will increase your risk for heart attack and stroke, which having type 2 diabetes already increases your risk. So we need to see if your LDL is elevated, so we could get you on medication to lower that and prevent a stroke or heart attack.
You can get a prescription usually once a year for a pair of diabetic shoes if you're eligible, if you have some neuropathy or if you have calluses on your feet. And those are special shoes that make sure you're safe and have enough room so you don't get sores on your feet, a pretty big wound on your foot and not really realize it. So,
right.
And then with the eye exams, we are actually graded, the doctor and I both, on certain quality measures. So that's one of the things that Medicare and the insurances look for, is if you've gotten your preventative care measures done. And eye exam, microalbumin, and lipid panel, and taking the statins, which is a kind of medicine, and blood pressure control is all things that we're graded on. And that affects overall healthcare costs for everyone. So it all works together and it's all important.
Yes, absolutely.
Anything else any other advice you would give for diabetic patients when they come into the office?
Say, take your medication. And how I mentioned earlier, exercise. I know it's hard to do because everyone's busy with work and kids and everything else, but exercising, try to, like you said, even if it's just walking or taking a hike somewhere, or just adding even a little bit of exercise in daily can really help improve your diabetes. I mean, and also another big thing is check your feet, because how I told that story about that patient I took care of, that could be you. And I know a lot of people are like, well, I don't have neuropathy, I don't need to check my feet. But if you have uncontrolled diabetes for an extended period of time, that's going to damage your nerves, and it's going to cause that neuropathy where you lose sensation and feeling in your feet. So doing foot exams and keeping up to date on your preventative screenings and your labs and your eye exams, just trying to do the best that you can to take care of yourself because you only have one body. So take, as best care of it as you can. So it's the best advice I could give.
Well, thank you so much for speaking with us today.
Thank you for having me. I'm so glad to speak on this topic.